In this video, we explain a study that discusses the challenges and possibilities of investigating ancient rare diseases, based on a case of Lecca-Weber-Test disease from the North Caucasian Bronze Age. The main objective is to approach the issue of how to define rare diseases in the past. What are rare diseases? In the modern clinical context, there is no explicit and globally accepted definition, but some often mention criteria. First one is that according to the European Organization for Rare Diseases, a disease is considered rare if affecting less than 5 per 10,000 persons, which makes 0.05%. But there is a strong geographical and socio-economic bias in prevalence rates and thresholds. Further criteria that are often employed are the unavailability of specific treatment, the degree of severity of physical and mental impairment, as well as a high level of medical and social investment that is required to maintain a basic quality of life for those affected. And this is also why rare diseases are an important issue. We need to support the 300 million people that are suffering from one of the over 6,000 conditions by sharing our sympathy and raising awareness to the rare disease community. On this Rare Disease Day in 2021, we do this by traveling back in time. But first, we take a look on the rare condition this study investigates, the so-called Lecca-Weber-Test disease, in short LCPD. LCPD, in contrast to the other mainly genetically related rare diseases, seems to have a multifactorial etiology. In the last decade, it is not consistently listed as a rare disease, as its frequency varies. LCPD is an idiopathic disease affecting children and adolescents, most frequently between 5 to 9 years of age, with boys being 5 times more affected than girls. It is caused by an avascular necrosis of the femoral head ossification center that leads to its collapse. Depending on the grade of deformation and joint incongruence, it may lead to severe degeneration in mobility, especially in adulthood, if not treated. The main feature is a mushroom-like enlarged appearance of the femoral head. Traveling back in time about 4,000 years, the skeleton of an adult male individual exhibited the typical phenotype of a healed Lecca-Weber-Test disease. He was found buried in a single grave at the Bronze Age cemetery Kudachut 14 in the North Caucasian foothills. His well-preserved skeleton showed the diagnostic unilateral enlargement and deformity of the left hip elements, visible macroscopically and on the CT scans. His left thigh was twisted inwards, and we can be sure that he had a limping interwing gait. The yield fracture of his right thigh that shortened his right leg certainly did not make his life easier. But was LCPD actually a rare condition in the past? Our literature review comprised 4,000 years of disease history. 20 individuals with femoral head morphologies ascribed to the LCPD were reported in the archaeological literature, with our male from Kudachut 14 being the oldest so far. Many of the documented cases occur in Europe, but studies from China and Argentina prove that LCPD occurred also in different parts of the world. Most of the cases are known for later periods, like the Middle Ages. So, with only 20 ancient cases reported, does this define Lecca-Weber-Test disease as an ancient rare disease? In order to answer this question, we reflected on the main characteristics for rare diseases used today, that are measure of rarity, high levels of impairment, and therefore high demand for medical and social care. Even modern studies on rare disease frequencies struggle to detect exact rarity in terms of true prevalence and diagnosed prevalence. Observations are based on a global perspective, and certain rare conditions may occur more frequently in particular regions. And this is also true for modern as well as ancient LCPD cases. Moreover, it is not possible to calculate reliable frequency measures for the past. Furthermore, physicians and paleopathologists do not investigate the same proportions of affected populations. In modern cases, it's mainly the pediatric population suffering from an acute cause of LCPD. In paleopathology, subadults with acute affection are mostly missing, and researchers are predominantly dealing with follow-up patients who, in contrast to today, received no comparable treatment. It is obvious to ask if dimensions of suffering and level of care play a role in defining an ancient rare disease. Inferring the degree of suffering in archaeological specimens and societies is impossible, because it's a very individual issue. Moreover, we cannot take the tremendous efforts in modern social and medical care as a reference for past populations. But when we look on the functional and clinical aspects of impairment and integrate the social, cultural, and economic context of the case under study, as recommended by the bioarchaeology of care concept, we still can learn a lot. For the male from the Northern Caucasus, we assume that the level of physical impairment caused by the LCPD was not severe enough to require assistance to fulfill his basic needs. But maybe short-term support, such as a relief from obligations associated with increased locomotion or walking aids, may have been required to ensure a good quality of life for him. The limping and reduced physical strength of the left leg, from childhood onwards, was probably perceived by this community, even if maybe not as a rare disease. But in addition to his hip disorder, he had survived severe fractures of his skull and thigh as an adult, which certainly meant that his fellows took care of him. And apart from this, the wear patterns of his teeth showed that he used them as tools during working processes, just like the other people did. Also, the objects that he was buried with showed that he did not hold a particular high social position. So, all in all, there is stronger evidence for the social integration of this male than evidence for his isolation or ostracism. But coming back to the very beginning, what does all this mean for the definition of ancient rare diseases? We now know that the modern criteria of rare diseases applied on ancient skeletal remains are either non-transferable or require competition. So we conclude that rarity is dynamic. Rare today does not necessarily mean rare in the past, and taking a paleopathological as well as a paleoepidemiological perspective is required. As a consequence, we would not recommend static prevalence thresholds as it is done today. We will probably always underestimate the number of ancient rare diseases compared to today's numbers. Often, we will have to accept etiological uncertainty. The number of ancient rare diseases with unknown etiology will presumably remain higher than those in modern rare diseases. Context is crucial. If a condition represents an ancient rare disease, may depend on the archaeological context and thus the socio-economic background of the societies under study. Degree of impairment, functional and social implications, and level of required care cannot be used as a direct criteria for an ancient rare disease. But adding this information is necessary to increase knowledge about the social dimensions of rare diseases in the past. What else was there to learn? Humankind has always been confronted with rare conditions, but also that being affected by one does not necessarily mean social isolation. Because we are in this together.